Hello, I'm John Kanelopoulos, Clinical Professor of Ophthalmology at NYU Medical School in New York City, New York, and Director of the LaserVision Institute here in Athens, Greece. And it's my pleasure to introduce to you this very novel device. This is a topographer like no one you've probably seen before. As you can see, this is the projection module, which instead of the classic circles or the slit that we're used to with OrbScan or Pentacam or other scientific images, it projects this multitude of LED colored spots. And as you can see here, there's 7 different triangular surfaces which are relatively flat, but in conjunction they create a sort of dome, a colored dome with 698 spots. The patient fixates in the central circle with the blue LEDs, this is the pattern that is reflected on the tear film of the cornea, and this is a reflection topography, and the image is captured, and we'll show you how the data is analyzed and what are the potential advantages of the Cassini, this multicolor spot reflection topography. So let's go on the other side, the examiner side, and see how these data correlate. So let's go on the examiner side now. This is a lady, we did cataract surgery today, and as we have been doing the last several years, we're analyzing data from the LensStar, the IOL Master, Placido disc classic topography, Sine fluke topography, the Pentacam, and now the Pentacam HR. These are the data on that lady with the Cassini. And as you can see here, we're going to try and zoom on first the raw data, and this is the reflection of the spots that we saw before on the surface of the cornea. You can see we're losing a little bit of the cornea image from the upper eyelid. This way the examiner can evaluate the actual raw data. We're going to go back to see each individual map, but first feature that I personally like is you can see here the keratometric indices, steep K 4354 in this lady, cataract surgery with a toric IOL that we did today at 92 degrees, flat K 4115 at 2 degrees, and astigmatism of 2.39 diopters. And on this particular patient, we had discrepancy between Sine fluke, Placido, and the LensStar, and we went with the Cassini numbers as we have found something we're publishing this year of much higher reproducibility in determining the degree and axis of astigmatism in cataract surgery patients. We were seeing here the topographic indices, mainly sphericity is the key number here, before and after refractive surgery. We have some intrinsic data of the machine, the image quality, the coverage of the cornea. It detects 76% of the cornea, alignment, axis, and latitude, as well as the classic keratoconic indices present in most topographies, the surface regularity index, the SRI, and the surface asymmetry index, the SAI. Going back now to an elevation map. This elevation map is extrapolated from the curvature data that the machine is analyzing, and you can also see limbo and iris architecture as a background to these images, tangential curvature seen here, and you can see with brighter colors the actual data, and with more lighter colors, lighter hue colors, the extrapolated data. Refractive power here, and again this is the axis that we use for cataract surgery, toric IOLs, and the actual curvature data seen here. Again, the same thing, bright colors, the actual data, and the lighter hue colors, the extrapolated data. I want to go back to the raw data and just explain to you where I think the intrinsic advantage of this device is. With Placido disc computation, the central cornea ring is the baseline, and each subsequent peripheral ring to that is measured by Placido disc devices to calculate the cornea curvature. Now with the Cassini, every 3 individual spots seen on the cornea are analyzed between them to create the milieu of curvature changes in the cornea, giving us a much higher accuracy in the center. So in specific, for cataract surgery, and as we have seen studying with OCT epithelial maps in older patients that may be dry, placido imaging may be off because it's not very accurate in the center, and sine-fluke images sometimes may be off because of the cloudiness that a dry cornea can affect the quality of the sine-fluke images. And this is where we think the Cassini, and we've seen clinical in our practice, may have a significant advantage. Being able to get very good within the 5 millimeter, which is important for cataract surgery, data for calculation of the amount and access of the astigmatism. We're going to go on and show you an example of keratoconus, patient we've done before and after the Athens protocol, which is combined topography guided partial topography, PRK normalization of the cone, and high fluence collagen cross-linking. Okay, so this is the keratoconus patient that I mentioned before. We're again seeing here the indices. Steepest K 41, 43, flattest K 39, actually 38 at 50 degrees. The topographic indices, as usual in keratoconus, very high asphericity, and surface regularity index and surface asymmetry index are obviously irregular, making this a very easy diagnosis of keratoconus. Again, I'm going to go and show you the row data. You can see here all this part of the 698 color LED projections captured on the surface of the cornea by this very high definition camera. And we're seeing here the elevation, extrapolated elevation map showing the cone, and the tangential curvature map, which we're all more accustomed to. The actual measurement is with bright colors, and the lighter color hue is the extrapolated data. On this particular patient, refractive power here, again showing the keratoconus in this particular patient, and actual curvature here. Again, in keratoconic patients, I want to reiterate the point that with degradation of Bowman's membrane and sometimes some subepithelial scar related to contact lens use, this device may be more accurate than placido disc imaging, which may be off in the center of the cornea, and sine-fluke images which require absolute clear cornea to be very accurate. So I think we're entering a new era where correlation of these different topography measuring devices will give us a more accurate and precise understanding and clinical judgment. I thank you very much for your attention.